Uh, Good afternoon, everyone. My name is Faisal Haq. I am a UK graduate currently working in urology in NHS. I welcome you everyone to our educational webinar on a sneak peek into psychiatry as a career choice. This is hosted by Dhaka Medical College Alumni Association in UK. Just a few words about the DMC Alumni Association in UK. So Dhaka Medical College Alumni Association established in 2021 to bring the graduates of Dhaka Medical College from Bangladesh under one umbrella. Since then, the DMC Alumni Association in UK has been involved in many activities, and one part of them is educational activities. We are glad to say that we have hosted quite a few educational activity webinars and also a few face-to-face activities over the last few years. And this is part of our continued educational program and webinar series. So today we have two fantastic guests amongst us to talk about psychiatry. So obviously we are discussing about psychiatry training pathways and the career choice in UK. We have So personally, I am a surgical doctor, so I don't have a lot of expertise on psychiatry, obviously, but I find it very intriguing because to deal with and to work with the human mind intricacies, what the psychiatrists do, I find it very, very exciting, very, very intriguing, and something I don't think many people would find it easy. So to talk more about these and how to become a psychiatry specialist in UK and how to climb the training ladder and how to navigate through this difficult path, we have two of our speakers. So I want to introduce to both of our speakers. The first speaker is Dr. Saqib Al Rashid Saki. Dr. Saki, you can see his smiling face on the screen here. Dr. Saki is a trainee in psychiatry who just recently started in North Wales in Wrexham Miller Hospital. Prior to that, he has worked in Wales and has achieved secured a training position this year. Um, and he is a graduate of Dhaka Medical College. Our second guest is Dr. Nusrat Noyon. Dr. Noyon is uh, again a co-trainee year 3 in psychiatry in Sheffield Social Health and Social Care NHS Foundation Trust. She is also a graduate of Dhaka Medical College. Many of you may already be familiar with Noyon. Noyon has conducted many sessions. I am aware personally, and she has been guiding the people interested in psychiatry in UK for a few years now. So she's not new to this type of sessions, I'm pretty sure. Both of them are both of them will uh, give us a fresh perspective and render us some guidance today to how to navigate and climb through the psychiatric training ladders and tell us more about psych examination and in general give us an idea about life as a psychiatric doctor in UK. So without any further ado, I'd like to uh, start the first part of our presentation, which will be presented by Dr. Saki. Dr. Saki will discuss about the psychiatry training application process, the competition ratios, the scenarios of psychiatry trainings and jobs these days, and also talk a bit more about the MSR exam, which is a prerequisite for psychiatry training. So, Dr. Saki, I welcome you for your part of the presentation. Thank you. Dr. Saki, I think you need to unmute your mic.
Thanks a lot, Faisal Bhai, to say very well to attend this session. Hello, can you hear me now?
Yes,
Hello.
we can hear you, I believe. Thank you.
Can hear you.
Yes, we can hear you. You need to unmute. Yes.
Hello, hello.
Yes,
Can you
we
hear me
can hear
now?
you, Saki. Yes, we can hear you.
Hi. Thank you, Faisal Bhai, to say very, very nice words about us. I'm very glad to attend this session and to help some our fellow colleagues and medical students. So I'll not delay. I'll start sharing my slides and discuss our topics of the session today. Okay. To the people who just joined now, so I'll introduce myself again. I'm Saqib Al Rashid. So I'm currently working as CT1 um, in Wrexham Miller Hospital, North Wales. So I'm a CT1 under Betsy at one of the University Health Board in North Wales. So the topics we will cover in UK. So how it is structured from core training to high specialty training, and also how we can apply for core psychiatry training. Most importantly, MSR exams, and what is the eligibility of applying core psychiatry training. And at the end, I'll try to briefly discuss about preparation of MSRA exams. Okay. So core psychiatry training starts, the whole psychiatry training in UK starts with core trainees. So from CT1 to CT3, during these years, trainees rotate through different specialties, uh, general adult, old age, child and adolescent psychiatry, learning disability, sometimes liaison psychiatry, forensic psychiatry, and so on. So during this training, trainees have to undertake few formative assessment like workplace-based assessments, and also a summative assessment, that is MRC psych exams, that is consist of Part A, Part B, and CASC. So after completing the assessment and completing core psychiatry training, one can be able to enter into high specialty training that is consisted of 3 years in different psychiatry subspecialty. So one thing is very and interesting about psychiatry higher specialty training. The training, higher specialty training in UK, there are 4 years. Surgical specialties are more than that. But if someone tries to have dual CCT, like somebody wants to be specialized in general adult psychiatry, plus they want to do other thing like OPMH, learning disability, then they can extend their training for a year. So in that case, higher specialty training would be 4 years in a row. In these slides, the next one, I try to show some specialities. In that specialities, people can achieve higher specialty training. Also, I didn't mention one thing. Nowadays, there is a training pathway. They call it Randro training. So it's only in learning disability and child and adolescent psychiatry. So in this training pathway, the posts are very, very limited. As far as I'm aware, it's around 5 to 10. It differs every year. So in Rando training, people can start an ST1. So without applying for high specialty training after core training, they can continue their training up to ST6. But in the meantime, they have to take MRC psych exams. They have to undertake lots of assessments in the meantime, so that they can progress their training up to CCT level, up to consultant level. Okay. So this is about recruitment timeline. So normally, the main entry point is round 1, recruitment. So I have put some dates, like normally every year, they actually try to arrange their timeline according to that, but it's not like fixed. Sometimes they can change. So normally this year, the application started from 24th of August. Normally, the window ends around end of November, and they, in the meantime, when they opens the window for applications, they give us a deadline for CREST submission deadline. So I'll discuss about CREST form later. So this is about the timeline. and invitations. In the meantime, they assess the applicants about the eligibility, they long list the process, and then they will tell you that if you are eligible to book for MSRA or not. And the other rounds is, some people call it round 2, sometimes they call it round 3. But if I clarify, only whole the year there is 2 rounds. So one is for August intake, when the most posts are available, largest number of posts are available during the August intake. And the other one is February intake. So for February intake, they opens the window around July time. And around September time, you have to sit for MSR exams. And in the meantime, they will release the offer. You will apply for your location preference and so on. Then in the meantime, they will process all the paperwork for joining the training. Then next topic is about our competition ratios. So these data I try to extract from specialty websites, and I actually made a table so that we can actually compare like how much the competition ratio is going up every day. It's like going up like very, very steep. So things has changed a lot. Once upon a time, psychiatry was seen as less competitive. So government and the recruitment deaneries, they used to announce incentive so that people join this training, and lots of the posts around peripheries like around Wales, Scotland, and Northern Ireland, most of the posts remain vacant a few years back. But nowadays, the filling rate is 100%. So if you can see on the table, like on 2022, the ratio was around 4. On the next year, 23, it became 5. But after 23, it's doubling every year. So for 2025, they didn't release the exact ratio, but depending on my score and depending on my ranking this year, so I tried to extract this data. It could be plus minus, but it should be nearly 15 or 20, around this range. So why this is happening? There are a few other things I would say. This competition ratio doesn't always reflect the exact data, because the people who are applying for psychiatry, if you know that MSRA covers lots of specialties. It covers GP. You can apply for surgical training like general surgery. You can apply for anesthetic, and so on. Lots of specialties are covered by MSRA exam. So people who are applying for GP, they might apply for psychiatry. Like, let's say my preference was psychiatry. As a plan B, I also applied for GP this year. So like this competition, but to be honest, competition ratio is going up and up. So there are a few other reasons, I would say, why this is going up. Number one, I would say the non-training jobs posts are going down and down. So for some reason, NHS is funding non-training posts very much. So the posts are going down every year. And also UK graduates and graduates across the world are also increasing. So depending on the situation, actually the recruitment authorities, they're not increasing the post. Like if you say about the post number on last few years, the posts are around 500. They didn't really increase the posts. So competition are increasing every year. Also, there are a few other things about psychiatry, why the competition ratio is increasing every year. Psychiatry is appealing for many people because of the work-life balance compared to many other specialties. And also, after pandemic, COVID pandemic, people are raising their interest in working in mental health, because after this pandemic, people actually realized how mental health is important for every people, because there is no physical health without a good mental health. That is, they say, about psychiatry specialty. And another factor about this competition is selection system. So psychiatry is a specialty. You don't have to prepare your portfolio very well, to be honest. You don't have to sit for an interview. You just have to crack MSRA. So that means a lot of people apply just to see how they do, and they actually inflates the competition ratio. Okay, and next slide, I'll briefly discuss about the eligibility requirements. As I said earlier, unlike the other specialties like IMT, you have to build up a strong portfolio. You have to showcase your some presentation, research, publications, and some other postgraduate degree like PG Cert, masters. This is not a case in psychiatry. That is a good thing. So simple eligibility requirements day once. So you need a full GMC registration. So you have to complete your foundation year 2. So if I clarify this thing, in different countries, specialty in Bangladesh, our internship is just for 1 year. But in UK, internship is 2 years. It's foundation year 1 and foundation year 2. So to be eligible to apply for these training programs, any of the training programs, any of the co-training programs in UK, you have to have a 1 year extra of clinical experience after you complete your internship program. So that is FI2 equivalent in comparison to the UK. And also, so postgraduate experience is, as I said, you need to have 1 year of clinical experience after you complete your 1 year of internship training program. And CREST form. So if you don't complete your internship program, like foundation program UK, if you are an overseas graduate, you need to have a CREST form, which actually called Certificate of Readiness to Enter a Specialty. So any consultant, any qualified consultant, if you have worked under their supervision at least 3 months, they can sign you a CREST form. So in UK, if the consultant is working in the UK, they must be on GMC specialist registrar. Like if you know that there's a GMC registrar, so there's a GMC specialist registrar. The consultant or the person who is signing your CREST form, they should be on this registrar. Again, if your consultant doesn't work in UK, he's from any other overseas country. So when you submit your CREST form, you need to show you have to show some proof, like he's a consultant, he got postgraduate training. So if you show their registration in licensing authority, and if you have proof to show their consultant level hello, sorry, there's a participant called Safina. Could you please mute your mic, please? Thank you. Thank you, Lo. Okay. So what I was saying, if your consultant is working outside the UK, you have to show some proof, you have to show some certificates that they are a consultant, and they are working as a level of consultant. They have postgraduate training and certificate equivalent to UK. And also the certificate must not be older than 3.5 years. Like you are applying in 2025. If you got a CREST form, which is signed in let's say 2020, it's not applicable. It should be within 3.5 years. And so what is the CREST form? What does it say? So it's actually a few papers of a form. It actually says that you have competency as a level of post-foundation doctor. You have relevant clinical skill, you have relevant communication skill, you have relevant leadership skill. So these are just a tick box. Your consultant need to tick box this thing, and signed and stamped with his name in the hospital he is working. And after completing this thing, you have to scan this CREST form and upload on the Oriel website. So what is Oriel? I'm going to discuss on the next slides. So how would you apply for trading? So when they opens the window, I would say before they open the window, you create a Oriel account. Oriel is a website, which is a general website for all specialty training application. So you have to open a Oriel account. You have to fill up your profile with names, either date of birth, etc., everything up. Then you have to, when they open the window, you have to submit your application, and with application, you have to upload your MSRA form. Then in the meantime, they will check your MSRA form. They will check that whether you have post-foundation doctor or not. If you are a proper post-foundation doctor or not, then they will check it, and they will let you know that you are eligible to take MSRA exam. So after that, they will give you a link, a window to MSRA exams. There will be few dates you have to book for MSRA exams. And also you can select where you will book for your MSRA exams. So it's a remote exam, I would say. You have to go to a location. There will be device computers. You have to sit in front of the computers. Then you'll take your exam. So this part, I'll discuss about MSRA exam structure. So normally it's two parts exam. One is clinical problem solving. It got 97 questions. You have to answer them in 75 minutes. So which is a really challenging thing, I would say, because if you calculate this time, you are getting only around 45-46 seconds for per questions. And another part is they call it professional dilemmas papers, professional dilemmas question. You have to answer 50 questions in 95 minutes. You are getting around 2 minutes, 1 minute 54 seconds per question to answer this. So what is professional dilemma question? Clinical problem solving, you'll understand that they will ask question every few bits of your MBBS or your graduation level syllabus. If anyone has taken Plab 1, I would say they're quite similar to Plab 1 questions. They will ask questions medicine, surgery, psychiatry, kind of core level of questions from your MBBS curriculum. So the more it's actually they'll ask you some ethical scenarios, if someone has taken Plat 2. If you remember, there are some ethical scenarios like they every day to the work. It's not good. So how do you escalate this in your situation? Would you go to speak with them, or would you escalate this situation directly to your responsible consultant, or do you make gossip with other colleague that, look, this man is coming late every day? So this sort of questions, ethical questions, comes in the professional dilemma. So I found it very challenging, I would say, because most of the people thinks, most of the cultural background will give you different answers. Okay, so so I would say if someone is preparing for MSRA, I would say give more time, give more efforts in professional dilemmas part. So if I want to discuss about the preparation bit, so how do you approach? So first of all, I would say start with the official MSRA handbook. If you Google MSRA, there is a dedicated website for MSRA exam. Go through their official handbook. There are a few simple questions. Try to solve them. That way, you have an idea about how the question pattern is. And also, there are many question banks which are really good. Most common, most popular question banks are Past Medicine, MCQ banks, Samsung's, eMedica, this thing. So don't worry, you don't have to go through the all question banks. I would say if you go through at least 2 question banks, if you practice and solve them and revise them, your preparation should be good. Your marks should be high enough to get a post. And obviously, the more you can practice, the more subscription you can buy, the more you can practice. It will increase your chance to get higher numbers. Apart from taking preparation, I would really advise you to practice some mocks. The question banks, Samsung's question banks, they got few mocks. I think that they got around 10 mocks. I would say try to practice them all, because in the real exam, under pressure, you'll hardly go through. You'll have chance to go through. You'll not have chance to go through all the questions very well, because especially in professional dilemma part, you could think that 1 and 54 seconds is a lot, but it's not enough, because there are few scenarios you have to weigh between them. You have to think deeply what is right, what is wrong. So it's very much confusing. And there are few other questions in professional dilemma parts. They will give you 5 options. You have to rank them from the best to worst. So you have to rank your decision, 5 options. So it's a little bit difficult, I would say. It's very much difficult. So if you want to prepare for professional dilemma part, I would say go through GMC Good Medical Practice Guidance. Most of the scenarios, you have to apply GMC Good Medical Practice, their laws and their ethics. And also, I found there is a book. It's called Oxford Assess and Progress Situational Judgment Test. So they got a few hundreds of questions. If you go through these questions, if you practice them, you'll have a good base for ethical scenario. Okay, that was my presentation. If you have any questions, I'm more than happy to take the questions and answer them. Also, I'm available on the Facebook. If you have any question later on, you can knock me on the Facebook and try to introduce yourself, because this text might end up in my spam folder. But I'll check. I'll try to answer every questions if I can. So if you guys, anyone have any questions, I'm happy to answer them.
Thank you very much, Saki. Yes, just to let everyone know who has joined a bit later that we have a dedicated question and answer session after our 2 presentations. So we will be taking all the questions from you guys. So do drop them in the chat box. I am keeping an eye on them. And after our next presentation, we will try to clarify your question to our best knowledge. Thank you. I can see a few questions popping up in the chat box, which is quite encouraging, and we will address all of them towards the end. Thank you for your understanding. Excellent presentation, Saki. I think this will be helpful for many people understanding the training pathways, rounds, MSRAs. Not easy for someone. I understand people who has worked in NHS for a while, it might be easy for them to navigate through a bit easier, but for people who are also applying from outside UK, it's not easy to navigate through. So both groups will be really helped by your presentation today. Thank you. So next we have Dr. Nusrat Noyon. Noyon will try to tell us a bit more about MR Psych, bit more about the psychiatric training, and she has been a trainee for 3 years. So I am hoping to get some more insight during the training life. And Noyon also has applied for her higher specialty training, and I'm pretty sure she'll have a very good score on that as well. So without any further ado, I'd like to introduce Dr. Nusrat Noyon, who will be joining us for the next part of our webinar. Thank you.
Thank you so much. Thank you so much, Faisal Bhai, for the opportunity and inviting me as a guest. And thank you so much for presenting and having the excellent slides putting on Saki. It was really insightful, and I was trying to relate when I started my training as well, that how the situation that time and how is the situation now, and really well done for securing a post in this really competitive time. But it just reminds me that people are really scared nowadays to apply for psychiatry training. But Saki has proved that it is still doable. Although the competition ratio is getting really higher, but it's still doable. So if you guys want to come and join the psychiatry post, just grab it, just do the MSRA. It can be set from Bangladesh or any other country. So once you hit the eligibility criteria, just go for it. There is no harm. It doesn't cost any money. So that is the biggest thing. It doesn't cost any money. So you can take this exam. Okay. So without further delay, just to introduce myself again, Dr. Nusrat Nayan. I'm one of the co-training year 3 doctors. I'm currently in Sheffield Health and Social Care NHS Foundation Trust. I am currently based in Eating Disorder Service, which is a super specialty, like a very specialized one, but it's part of general psychiatry or general adult psychiatry. So I'm going to put up my slides. Okay. Okay. So let's begin. So to start with, we're going to talk about inside psychiatry training in the UK, training structure, MRC psych exams, and how is the work-life balance. So I just don't want to overwhelm everybody because things might seem really difficult. That Saki has explained that things are getting a bit harder and tougher getting into the training. So many things needs to crack on when you try to get inside the training, and then so many things I'll be talking about as well, that after once you have entered into the training, then you will have many things to crack on. But I just want you to reflect for a few seconds that these are the things you don't have to do straight away. You can have your own sort of like calendar, or you can have in your diary that these are the time frames I'm gonna do. Like if you keep thinking in your head, so many things I'll have to book for MSRA, then study this and that, and then the city 1, 2, 3. So many things can be in your mind, and this might overwhelm you. So just to begin with, please just make a calendar or like a diary and see that, oh, these are the timelines. I'm gonna finish this, and this, and then you will be much more relaxed. You don't have to keep thinking, and you don't have to have nightmares. Okay? So have a little bit of break in your mind. Have few seconds. If you need to grab any coffee or tea while having this presentation, just go for it. Okay? I hope you will enjoy the slides. Okay. So, as Saki has touched, I have just put this one overview because just to show that where am I sitting at. So I had all these rotations like general adult, old age camps, liaison. I just finished my forensic and currently in eating disorder. So I have got lots of posts across city 1 to 3. And then I am sitting basically somewhere between the CT3 and ST4. So that is a bit of a challenging bit where I have just applied for it, and we will see where it goes. Um, and then as the higher training, as Saki has mentioned, that you might choose doing a dual training depending on what sort of posts are available. Dual meaning either it can be tagged along with older adult and general adult, psychotherapy, older adult. So this time the training get a little bit of extension. And to be fair, I was sort of a person who would never want any sort of extension, but once you have started your training, you will find that most of the people likes to be extended because they want more and more years before they can become consultant. Because once you're in the training, you feel you have a structure, there is team around you to support you, there is a consultant above your head to guide you. But once you become consultant, everything is on you. Okay? Although it's a team decision, but anything that is failing off, consultant would be the one to get blamed. Okay? So it's not a bad thing to have extension. People go from 100% to 80%, 80% to 60%, and have longer core training or longer higher training. And you have a really good life, like as a very good work and life balance, because many of the days you are off. Okay? Although your money get deducted as well, but again, many people can do some other things as well. They can start a side business, for example. They're doing a business, they're relaxing at home, and then they're doctor as well. Okay? So once you have completed your higher training, then you can apply for certificate of completion of training, and then you become eligible for consultant roles. But again, many people don't choose to become consultant because they still want to carry on with the training. So they might extend it, or they might have some specialty doctor's job and they carry on being a specialty doctor and they don't become consultant. So absolutely fine, whichever path you choose. Everything has its own pros and cons. We are going to talk about this a bit more as well. Okay. Now, from settling in to soaring ahead, each step a mark of your progression. So settling in. So Saki has nicely mentioned that what are the pathways you will adopt and how cracking on all those difficult times with MSRA and then setting your first step in the psychiatry world. So many of you might not have experience at all in psychiatry because if you have looked into the eligibility criteria, nowhere it says that you need extensive psychiatry experience. So many of the people have joined psychiatry probably only 5 to 10 days psychiatry experience in medical school and not more than that. So many of the people might say that, well, would I be straight jumping on into the fire then? No, you wouldn't. Most of the trust will allow you some shadowing period of time, most of them, okay? So you're gonna observe, understand the local system, gradually will take on the responsibilities without any immediate pressure. So there will be a team around you who would be helping you. So the mental health nurses are really experienced. So this is one of the biggest difference, I would say, compared to other specialties and mental health team, where the nursing staffs are really experienced. They can do really good risk assessment. They have been here for ages, perhaps even longer than the consultants are. So they know the patients really well. So you can share with them, discuss with the other medical doctors, discuss with your consultant. Nobody would mind when you first start the rotation. And eventually, as you progress, you will become more confident. You will understand, oh, this is how things are done. And then it's all good to go. You can do your independent assessment as soon as like 3 weeks have passed. You will feel more confident moving along. Yeah? Okay. So the other thing is ARCP, which is the Annual Review of Competence Progression. So this is pretty much similar in all other training. So what that means is that every year you are going to have an annual review of your portfolio. So there will be certain portfolio requirements. It's all in the silver guideline of MRC Psych or Royal College of Psychiatry portfolio site. So you will be given a portfolio and you will be given certain number of requirements based on you are in city 1, 2, or 3. Okay. So, and again, you don't have to do everything on your own. Everything, you will have your clinical supervisor, you will have your educational supervisor, and then lots of peer support as well, support from your friends, colleagues, who are more than happy to guide you that how to build this portfolio. You can ask around, okay? So for example, you need a case-based discussion, you need mini-A's, which is, for example, you have done some sort of assessment, your consultant has observed that, and he or she would be happy to sign you off that, okay, this person has done a risk assessment for this patient, so I'm going to sign a mini-A's. So you can send a ticket through your portfolio and this can be signed off. So don't worry about this. As I said, that it's not many in the numbers, and this can be easily done because I have done a lot, even more than the number required, and I was told like you don't need to do too many. You are gonna exhaust yourself. You just do like whatever needs to be done. So as long as you hit the minimum number and maybe do like an extra of each if you want to, it should be fine. Okay. And then the outcome, obviously, the outcome will indicate whether you are going to progress to the next stage of the training, which most of the people would do. That would be progressing from CT1 to CT2 after their ARCP. And again, if there is any shortcoming, if there is any pitfall, everyone is so supportive, most of the trust, they will tell you what you need to do. Maybe you are short of one CBD, for example. They will tell you, they will give you some timeline that can you please finish before this deadline. You will have some time, couple of months to finish them. If you still can't, then obviously, then it will be a bit more extension of the training because lots of personal things can happen. Someone may fall off sick, someone have got maybe personal issues, family difficulties, but it doesn't mean that you will be thrown off from the training. Unless you are really an harmful doctor, they wouldn't throw you off. Okay, they might extend some months of your training, but it's not like that they will kick you off the NHS. Okay, so you can relax. You will be guided through. If you have any difficulties, any physical health problem, any family issues, discuss with your clinical supervisor, educational supervisor. They will be helping you. Okay, right. Then, brief overview of MRC Psych. The reason I would be talking about it a little bit more because I keep receiving so many messages regarding exams where somebody is still a medical student requesting that if I can sit for MRC Psych exam, or perhaps somebody who is trying to build career in medicine, but saying that I'm not getting any jobs in medicine. So can I just crack on with MSSI completed and apply for jobs? So that is the reason I'm going to talk a little bit about it. I'm really happy that people are interested sitting for exams, thinking about psychiatry. But there are a few things to bear in mind that whether you are really eligible or what is it really, okay? So what is CMS like? So basically membership of the Royal College of Psychiatrists. This is definitely required before you progress for the higher training. So once you want to be an ST4 or the registrar in psychiatry, you must have MRCSI cleared. Okay? And it is recognized internationally as well. So, exam structure wise, it has paper A, paper B, and CASC. Paper A and B are theoretical, which means it contains MCQ and extended matching questions. So, and the CASC is the practical one. For example, in the medical school, for example, if you have done the short case, long case, but it's more like interviewing a patient. Okay, like for example, in OSPE, in medical school, third year or fourth year in OSPE, what we did, that you were sort of having a brief conversation with the patient. So similar to that, and talking about more while you are in medicine or in any other rotations, then you are interviewing a patient and then coming up to an diagnosis. So depending on the task, either it can be management, it can be diagnosis, or whatever the task is. Okay. So paper A is all about theory. So there are topics like neuroscience, pharmacology, behavioral science, human development. Well, I will say that to be honest, once you start reading through paper A syllabus, you might end up literally crying that I don't want to go through this MRC Psych exam. I think it's not for me. To be fair, it does feel like to everybody, if not everybody, to most of the people I have known across. So it does seem like I'm not doing this. I'm not doing this to myself. But anyway, once you go along, once you have finished crying all together, some of your friends and colleagues, you will find a way because there are resources I'm going to talk about. So once you find the right resources, once you go through it, and once you know that I need it because I need to progress in my career, it should be fine. People pass it. And the passing percentage is not so high. If you can score above 65%, most of the time you have passed it. So you don't need 100%. Okay. And just believe yourself that everybody is crying, perhaps. Okay. So paper B, which is the most interesting exam I have come across among these three, which is consist of clinical and statistics. So statistics is the one which is the key to pass this exam because this is mathematical. Well, this can sound again overwhelming because mathematics. No, I don't know when I did last maths. But then again, once you start, you might again have a good cry, oh my God, another exam. But eventually you will be fine. Um, for example, in paper B, I scored overall more than 85%, and the passing percentage was 65% around. So you will be absolutely fine if you know the technique. So again, I'm going to talk about some of the resources. CASC, well, there is a little disadvantage, I would say. Even the British graduates, they also say that we are at a disadvantage because English is our not first language. But again, people are passing. It's not like people are not passing the exam. People are passing all of them. So it just needs a bit of extensive practice. And it's a very timed exam, like in 7 minutes time, which is a very artificial scenario because we would normally take an hour to do an assessment, come up to a diagnosis. Whereas in 7 minutes, you are given multiple tasks like do assess the patient, do risk assessment, come to a diagnosis. And then in 7 minutes time is very challenging. But people pass this exam. Examiners know that this is a very time limited and artificial setting. Examiners know that by the look of us, they automatically might assume that we are IMGs, international medical graduates. English is our not first language. And we eventually crack on. Okay. So I passed these exams in first attempts. So it's doable. It's 100% doable if you practice in the right direction. Okay. Now again, the reason I have put this eligibility for exam because this is the thing I have mostly come across that people asked me a lot. So the reason I have put this link at the very beginning and an email of examinations itself because in this link, you will find all the information that you need for exams, starting from when to apply, how to apply, passing percentage, what are the materials you need to follow, syllabus, everything. Okay. In the email, if you have any doubt about eligibility, because people like us who are in UK, who have started our training in UK and then attending the exams, our eligibility can be slightly different to somebody who is wanting to take exam from Bangladesh or from any other countries. So eligibility might be a little variable. So I would suggest that if you're asking somebody, make sure that that person knows about it or that person has got a lived experience about it. If you are unsure that whether that person's scenario is matching to yours, please do email examinations at rcsite.ac.uk because they will respond to you within 4 to 5 days. They're very good in responding. So don't stop yourself giving the exam if you are unsure that whether I should proceed or not because somebody has told me so and so. And again, if somebody has told you take the exam, and then again, you don't want to go blindly and take the exam, and then you see that, oh, I'm not being eligible for the next paper. Okay. So to run through a little bit, paper A eligibility is that as soon as you become fully registered medical practitioner, you can take it. However, why did I then delay? I graduated my I graduated back in 2020. I finished my house job that time in Bangladesh. So why did I delay like until another 2.5 years? Because of this one, paper B. So as soon as you pass paper A, when you have received the results, you have got the good news. Oh, that's a very good news that you have passed it. Now you have got 4.5 years to finish paper B and CASC. I have seen some people, it may sound like it's a long time, but because the frequency of exams are only 2 to 3 times a year, people might have not made it within this 4.5 years, and they had to redo all the exams from before. Okay, so paper B, you will have to be on an approved training program, recommended experience for 12 months, or you are in a post recognized by your hospital having time funding for educational training. So you'll have to think about it, which pathway you are on. Most of the people who choose this one, that they are in approved training program, many of the time you will listen that some of them, I have recently had a query that are the HMO post, honorary medical officer post in psychiatry in Bangladesh, are they treated as shadowing? Which is, the answer is no. This is not a shadowing. You are doing all the things as a doctor. So what you need is that you need to have a letter or a confirmation that it's an approved training program. So, and that's it. And then is the recommendation that you will have to have 12 months experience. It's not a mandatory thing. So for CASC, again, you will have to have passed paper A, B, then you will have to have a sponsorship in your place. And then you will have to have like certain things like psychotherapy in place, child and adolescent or learning disability post in place. Okay. So again, the most important bit is you will have to have 23 months whole time equivalent post foundation. So this is a mandatory thing that you will have to have 23 months of experience. So think about it. You are happy. You have just passed your MBBS. You have done your internship. You have just done your paper A, and then you want to move on. Paper B. Oh, you'll have to get into a training. For example, you have just got into training, got your paper B, but where is that 23 months? You can't sit for CASC. So think wisely. You don't have to rush. Think wisely. Have this time frame in your mind. Okay. So again, as I said, 4.5 years, which is 1643 days from day one, once you have got your results of paper A. So how to prepare for exams? As I say, there are lots of resources, SPMM, Psych Mentor, Mosley, Oxford Handbook of Psychiatry, nice guidelines, peer group, like always have at least a group of 3 to 4 people for all these papers, for paper A, B, and the CASC. Okay. Now, life of a psychiatry training in UK from my personal experience. So a typical day of mine, okay, this is my best part, to be honest, as part of the presentation. So a typical day of mine, so it should start from 9 a.m. to 5 p.m. Again, being in a psychiatry training is such a blessing because most of the time you can have a bit of flexibility, particularly if you are in a community placement, then you can have a bit of flexibility. For example, if you have an appointment, you can always discuss with your team that can I come an hour late and can I go a little late, like an hour late from the hospital or from the community or from the clinic. So you have that sort of like flexibility. I remember recently I had to go for an Europe tour. So I left my work at 3, although I mentioned to them a few days earlier, can I leave at 3 p.m. instead of 5? But after coming back, I'll be working from 8 till 5 rather than 9 to 5, 9 to 5. So I came early 2 days, 8 to 5, 8 to 5. So my two hours, I left at 3 instead of 5. So it was all covered. I didn't have to apply for annual leave. So as long as the team is happy and you have agreed with the team that I'm coming early, starting my work early, it's fine. But I really can't think of anything like this. I'm just thinking because I worked in medicine as well. I can't really think of much of the days where I'll be leaving 2 hours early. They might be quite upset actually from inside that she's leaving early. She like, what is she doing? She's going for a trouble and keeping us like, in trouble. But as long as your team is happy, most of the time it's pretty flexible. It's not that you are doing it every day, every time, but obviously if you need to go, you need to go. Okay. Then in the morning, you can have like safety huddles where you will talk about all the patients which are like more serious, which will need like more urgent attention. So everybody will be there. The medical team will be there, one of the doctors, one of the nurses, occupational therapists. Most of the people will be there. So we get ourselves like divided into the works in the first 15 minutes at 9 o'clock. Then we will have weekly MDT meetings where again all these team members will be there. We will go through all the patients. So it's not yourself only that you will have to take decision. So I think this is another like a very good practice in terms of psychiatry, that there are a lot of MDT, like multidisciplinary team meetings. There is psychologist, there is doctors, again, physical health concerns as well. We take opinion from GPs, physical health doctors. So a lot of things actually come up from this MDT meeting, and then we divide our jobs, like who is doing it, who would be the best person to sort this out. Okay, so you are not alone. Documentation is very important. So once you are in psychiatry and if you are dealing with any patients, think about it that this could be my last interaction with the patient, and then the patient might cause any harm to themselves or might cause harm to others. So make your documentation in such a way you can challenge the court. Okay. So if that person has killed themselves, unfortunately, your documentation should speak on your behalf, right? So have a very good like sort of documentation. Think about the picture that if I had to present this in the court, my documentation should speak on my behalf. Risk assessments, again, as I said, you will be eventually taught how to do it. Teaching medical students, very nice. Like you have a lot of opportunities. The medical students are my favorite. So you will get a lot of teaching opportunities. You can have feedback from them. And again, that can be counted in your portfolio. And again, we have our alternate weekly teaching. We have weekly psychotherapy patient in CT2 and CT3 out of our on calls, which is out of 5 p.m. So it will be from 5 p.m. until 9:30, depending on trust to trust. It can be 24 hours. The 24-hour on calls are less heavy workload on calls because it would depend. The ones I had 24-hour on calls, that trust were less busier than the ones which has got 4.5 hour on calls, 12-hour on calls. Okay. And don't worry about it. But you will have to do mental health assessment, emergencies, but there will be always a registrar on call, a consultant on call, and the wards are very good with the nursing staff. It might feel a bit of daunting at the beginning, but it will settle as the time passes. So, and another thing, on calls are not every day. So obviously it can be like once a week. So it's not every day. So once every week, perhaps you do, or weekend on calls, and it should be fine. Yeah, you will have a rota. Learning environment. I would say that psychiatry is a really lovely specialty to have a very, very good learning environment. You have weekly supervision, you have got your own teaching, you can teach others. There are lots of reflection groups. You can reflect if somebody has told you something which has hit you really heavily. You can discuss with your team members that, can I have a reflection, please? I'm not feeling really well. I can't remember being worked in medicine that when people would be like, well, I'm really sorry for you, Nusrat, but there isn't such a setup that you will have a reflection kind of a group or a time aside for you to talk about what you have gone through. So you can really catch up with your colleagues, and that can be really therapeutic for yourself. Lots of opportunities for audits, for quality improvement programs, lifestyle. Oh, this is one of the things people really want to come to psychiatry for. Um, I had my, obviously, during my third year medical school, I made my mind that I'm going to have psychiatry as my career. So it doesn't apply for me, but it has come as a additional benefit that it offers a lovely lifestyle. As I said, that it's pretty flexible. You can work from home some of the days. You can finish your admin jobs like writing letters to the patient, everything. You will be given work laptop. So many of the days you can finish everything from home. You can attend some of the teachings online, some training online. So it doesn't necessarily need to be you have to have presence every day in your workplace, depending on your placements. Okay. Challenges. Okay. So this is a bit that we need to think about, that what kind of person we are. Sometimes the challenges can be heavier than the benefits. By that I mean, because you will be dealing with lots of depressed patients, anxious patients, psychotic patient who might really kick you off, can be really abusive towards you. Obviously, you will escalate and do incident report. Even you can report to the police as well. There is no harm. You can report to the police if they're abusive, but this can really cause emotional strain. Let's say somebody killed themselves after you have assessed and you have discharged. Again, this may hit differently to different people. Some might think, well, I didn't know that he will do that because he told me he doesn't have any sort of risk to self or risk to others. But then what happened, I don't know. He went home, maybe something else has happened, and then he killed himself. So somebody can take it literally as it is, giving report to the court like, well, my documentation suggests nothing what he has done. We can't see the future, can we? But then again, somebody can take it really personally, like, am I the one to get blamed? Like, why did I discharge him? I wish I had never discharged him. He killed himself. That's all my fault. So it's important that to train yourself a little bit, that I need to set a little bit of boundary. I would be really emotional. I can be empathetic that what has happened is not really nice, but at the same time, I can justify why I discharged him. So it will come with practice. It will come as you go along, as you become City 1 to City 2, City 2 to City 3. Then you become higher trainees. You become more and more a bit boundaried with your feelings. You can speak to your supervisor, speak to your colleagues, and they can also give you a lot of reassurance. So this is the thing where people sometimes feel like probably psychiatry is not for me. But these things most of the time settle down. As you go along, you will see that it is not becoming a difficulty. You may feel really sad for the patient, but that's part of your job. What you have done, if you can justify yourself that that was the right thing that time, is fine. Okay? Some of the stigma, people, again, different specialty might say, oh, you have chosen psychiatry because it has got a good balance. You are not a real doctor, are you? So again, it depends really, because things are getting really changed. People are understanding how mind and the body are really connected to each other, how sound mind is really important. So, but then again, you'll have to be really boundaried. Like, well, you can share, thank you for sharing your idea, but I really think that mental health is really important. Okay. So it's just like, will you care for the stigma around it, or you will just love your passion? Okay. Occasional safety concern. Well, if you are assessing a new patient, seclusion reviews, you might face some safety concerns for yourself, but then again, staffs will be there to support you. You are not alone. The number of times I'm mentioning, you are not alone at all. There will be staffs around you to support and help you. Okay? Thank you, everybody, for listening to me. I hope you liked it.
Okay. Thank you very much, Noran. That was a very, very resourceful and very elaborate presentation. I hope everybody has benefited from overview and life as a psychiatrist trainee and also the MR Psych. We do have a few questions, so I think that's very good. This is the most important part. We can always do presentation, we can always tell and keep talking, but what we want to know, what people want to know, right? So without further delay, I'll start with the questions. I mean, there are quite a few. Let's start from the top. So somebody from the top, Dr. Noreen Nusrat Nova has asked, for clinical experience, does clinical trial physician count? Any takers, Saki or Noyon?
Yeah, I think I can answer this. So it depends what sort of clinical trial physician placement the candidate is having. because for signing off the CREST form or to be counted as a foundation training, it should be a clinical placement. Like you encounter patient, you treat patient, you learn from patient. It should be that kind of placement. Like if you are doing a job which involves you see a patient, you learn clinical things, you work with a clinical consultant, and also on top of that you are doing clinical research, clinical trial, it will be counted as a clinical experience. But if you are doing a purely admin job, like only trial job that involves research, not seeing a patient, not doing any clinical work, not under any clinical consultant, so it will not be counted as a clinical experience. I think, I hope this answered the question. Thank you.
Thank you very much. So our next question is, I think this would be probably heading towards Noyon. Dr. Karatas is asking, what is your personal advice for resources? Or I mean, you can both answer. I think it was more resources for MSRA. That's what they were asking. Both of you can answer as you feel. They were asking which one to choose between two for resources.
Yeah, I can share my point of view, and Saki can also mention as well. So for the clinical, as Saki has rightly mentioned before, that there are lots of resources like Past Medicine, MCQ Bank, Samson wise. I found the mocks really helpful. I think Saki has mentioned that too. And for the situational judgmental, there is, as far as I can remember, Saki's slide mentioned that from the GMC situational judgment, good medical practice, that thing is really helpful, and Oxford SJT is really helpful. The other thing I would like to just add is FY2 standalone. So if you just Google it, that FY2 standalone for situational judgment, very, very helpful. For situational judgment, another thing is past medicine situational judgments were really helpful too. So the reason I'm saying is that because for situational judgment, it can be really difficult if you don't know what to follow. And if you read too many resources, you might get really difficult situation. So just to give up the list for SJT, one is Oxford, another is FY2 standalone, another is GMC Good Medical Practice, and the other is Past Medicine. So by that, you will have only 400 questions or something like that, 400 to 500 maximum, and you can really get through it. And for the clinical, apart from what Saki has said, the other thing which has helped me most is PLAB keys. If anybody of you have taken PLAB keys can be a really helpful one because the question is not like past medicine. It's more like two lines of question. So PLAB keys, there are some bullet points that you can crack on, sit in your head. You can actually answer those questions from PLAB keys as well. But the other resources Saki has mentioned were very helpful as well. Anything else you want to add, Saki?
Yeah, I want to add few things. So past medicine, I would say, is really good question bank. Uh, the way it is good that it got very good explanations that about that why this is correct answer and why other options is incorrect. They have very good explanation. So if you go through the explanations, then you will have a very, very good base. But the other thing is that, it's my personal opinion, no question bank is perfect. Every question bank have some pros and cons. So I found if you're looking for any mocks, Samsung mocks are really, really good. And it seemed to me, there is no proof, but I found that some of the questions I found it directly from Samsung mock, some of the scenario, but I don't know, I might be wrong.
No, I
But the
completely
problem
agree,
with the
Saki. I completely agree with that because Samsung mocks are quite similar to the exam question itself. So I found it really helpful.
but the other problem with the Samsung, in a actual question bank, some of the question, like some of the explanation are contradictory. Some of the answers are the wrong. So, and also if you go through the past medicine, the quality of questions in the past medicine is not too great. You'll not have these kind of easy going question in the real scenario. But if you can finish the past medicine going through the all questions, you will have a very, very good basic base for your exam. And also, I'll advise you'll not have time to go through all the question banks. So my suggestions will be, if you go through past medicine once, then if you solve any other one question bank, it could be past MCQ bank, it could be Samsung or e-medica. I would say if you have really, really short time, like if you have a month to prepare, then you can go for e-medica because they have very, very few questions. Like in every specialty, I think they give 30 or 50 questions. So that is not enough. So I would say number one, past medicine plus MCQ bank or Samsung, any of these. But if I share my personal experience, this year I was so desperate because the training ratios was going very, very high. So I actually solved past medicine, MCQ bank, Samsung, three of them. So I had a very good score after MSRA. So I had my first preference in place. That's it. Thank you.
Thank you very much, both. Well done, Saki. Well done, Noyon. And great answers. So I think there's a recurring pattern, like doing mocks, doing multiple. Obviously, if you're working a full-time job, you will be bound by how much time you can give for this present preparation. But taking mocks, always helpful, like any other specialty for any exam preparation. Let's move on to the next question, which is Dr. Mohammed was asking, is it mandatory to get full GMC registration before application of psychiatry training, or can I apply after PLAB 1 and finish the registration before starting the training? Any taker?
So I looked at the question when Nusradapu was presenting. I actually opened core psychiatry training eligibility list. So if I may share my screen, I'll show you.
Yes.
So if you can see, can you see Dr. Faisal Bhai?
Yes,
Yeah,
we can see on the
So
screen. Yes.
registration, it say be eligible to work in UK. That is, you have to have GMC registration, and this registration should be at the post start date for the vacancy.
Right.
So you can apply. In the meantime, before you starting your job, you have to have the GMC registration.
Yep. So you have to be very meticulous about your timings. So you need to time everything very, very well when you're applying for training, when you take PLAB 1, PLAB 2. Luckily, it is not COVID anymore, so people can plan and execute the plan better these days, I understand. But yes, so that answered the question. Next is Dr. Afra is asking, what is your, in opinion, a better for an overseas candidate to enter enter UK, whether after completing all MR Psych Part 1, A, B, and CASC exam and applying for non-training or training jobs, or by doing UK MLA and trying to get a training job via MSR exam? I mean, this is a very, very broad question, to be honest. There is no yes or no, right or wrong answer. Everybody's circumstance is quite different. But please do share your thoughts,
yeah.
Noyan and Saki. What do you
Yeah,
guys think?
I can touch upon that. Yes, as you rightly said, Faisal Bhai, that it's a very broad word and it can vary from person to person. But by the look of it, as Saki has rightly shared this screen, that how exponentially is increasing the competition to enter into MSRA through MSRA and getting into training, and passing paper A, B, CASC itself can take like at least 1.5 to 2 years, but then again, even more than that, because CASC itself requires 23 months of psychiatry experience. So, which means that if you are just starting in the psychiatry training and planning for CASC, you will have to at least wait for 2 years to sit for CASC. And there is no guarantee that in the first attempt we will pass it. So, which means that by that time, even the competition can be even higher. So what many people are doing recently is that, but that is again another option. You can do it. If you can do it, that's absolutely fine. So what many people are doing recently is that if they're fixed that they are going to have their career in psychiatry, they are fixed about it and they know it, what they are doing. So they are taking their paper A, getting into a training in their home country. So, and then they're getting into training and trying to have their cask coming to UK. And then they're getting the registration and applying for higher training or applying for a non-training post to settle themselves out because you don't want to jump straight away into a higher training as a registrar and you might feel a bit shaky. Still, it's fine. Many people are doing that. My own sort of opinion would be if that is your thought, take paper A, B, come to UK, do your cask, and get your all competencies signed off. Come as a middle grade, as a trust grade doctor, work for 1 year, then apply for higher training, and then you just continue as the registrar. This is one thing. Another thing is that if you think I want to come to UK bit earlier because we don't know how long it will take with the cask and my personal situation, I want to come to UK early. For example, for myself, I thought I need to come to UK early because I want to get trained from the beginning in UK. So you can come in again. You can have your PLAB 1, PLAB 2, get your GMC registration, enter through MSRA, do your exams as you roll along, like me, as CT 1, 2, 3, you finish all these exams and then move on. So depending on what circumstance you are having, but I have just explained both the ways.
Thank you. Thank you. I think the overall scenario and the overall air in UK currently is there's a lot of talks ongoing about UK graduate prioritization. A lot of talks ongoing about bringing back the resident labor migration test, which is you can only apply for a training in first round if you have the ILR. There's a lot of talks going on regarding this. So I think the theme of the answer to this question is the sooner, the better, if possible. But obviously, there's a caveat to that. Even if you are coming to UK as a psychiatry junior doctor, it's not easy to get a job as a junior doctor these days as well. So there's a pros and cons. So training is going up, getting difficult every year. So you need to look at the numbers, look at your own circumstances, and make the decision based on that. And speak to people like Nusrat and Saki who are already in this position, done Yosh, what you are trying to do at the moment in the past, and speak to people like them and make what decision is best for you. I think that is the way to go. Dr. Safina has asked some question depending on her own circumstances. She's a psychiatry trainee in her home country, has done her MR Psych paper A and B, and she's asking for advice on CASC exam. And as she said that not a lot of people pass on the first attempt. Her resources, there's something. So she is considering either between taking the CASC or taking the PLAB 1-2 route. And also, I mean, these are the things. Also asking about some challenges of living in UK, being a single mom of one. I'll try to answer that bit a bit myself. I mean, as a parent to two kids and everything. But I think the first part is more suited towards Nusrat about the CASC PLAB 1-2 and thing. If you don't mind answering that bit, please.
Yeah, sure. Thanks for the question, Dr. Safina. So, first of all, congratulations. Actually, you have passed like the written papers, paper A, and sorry, you have passed paper A and you are about to write paper B. I would say that if you are about to write paper B, if I were in your situation, again, this is a very situation to situation question. If I was in your situation and if I can pass paper B, then it's only one exam remaining, CASC, and you are already a trainee there. So why not like quickly finish? And even I know some people who have passed their paper B and then started applying for jobs in UK. And then they came here as a trust grade or a middle grade doctor and then completed their CASC. So it's just that to keep in your mind that I need to enter UK as soon as possible if you want to come in. If you want to delay, it's absolutely fine. But as Dr. Faisal Bhai and Saki has mentioned, that is getting tougher and tougher day by day. So you are already on the way. Write your paper B. Hope you pass the exam, which you would do, hopefully. And then as soon as you have passed your paper B, keep applying for jobs. And then meanwhile, you start preparing for CASC because you will be having the eligibility of 23 months. Try to gather that and then finish it off and obviously have your job. But it's a bit tricky because if you again start the process for PLAB 1 and PLAB 2, you can do that again. It depends on you. But again, it's a whole process then. You will have to do PLAB 1, you will have to sit for PLAB 2. So again, you can do it. But if I were you, you are already halfway through, if that makes sense. So you are already halfway through, so you can finish it off. And I agree that many people don't pass CASC, but that can be always. Like even if you have taken PLAB 1 and PLAB 2 route, it's not gonna change. The CASC passing percentage is a bit poor, to be honest, but it's not gonna change anytime soon. It will be a difficult exam as we go along. So I would highly encourage you to finish all this exam right after paper B, keep applying for jobs in UK. They will sponsor you if you are called for an interview. They will offer you like registration. I know some of them who have got their GMC registration, and then they are coming here and working, and then you can do your CASC. For single mom one, I don't have first-hand experience because I don't have kids. But then again, once you are here, again, there are like some day centers that I'm aware of. And in some of the hospitals, we are also thinking about that if we can start like a care sort of thing, like as a room where kids can play and mom can spend some time there with their kids. But I think this will be like a longer term decision. But I think there are lots of support available for single mom here as well. So it should be fine, hopefully. Yeah.
Thank you, Nusrat. Yeah, so I just want to touch up on that last point. I'm not sure, Dr. Safina, which is your home country, but even if say, for example, if you are from one of the South Asian countries, if I understand, or if you I think that is the case, the support system for your child will be better in UK. There's no doubt of that. Yes, people who are single parent have done it. I know personally a few people who have done it. So do not feel discouraged about by that fact. You should crack on with your plan. You can. The only thing you need to make sure, obviously, uh, if you come here, if you do not have your immediate family member to look after your child, then you need to arrange for child cover, which will be cost some money. So you might, on a personal level, you might have to do some extra work, locum work, things like that to make yourself more comfortable. But somebody who's a single parent with one child, you should be still fairly comfortable with your finance and everything on a personal level. But there is a lot of, I mean, so for example, I personally, where I work, my hospital and the mental health hospital is close by, and in between two of them, there's one daycare center. And I know a few people who work who as GP and keep their child in the daycare center. So these support systems are here. And if I don't know how old is your child, if they are relatively younger, like 3, 4 years age, you can also get some state funded hours for daycare as well, depending on your visa status and the age of your child. So these are the support system available. So and I'm sure you can work with that. So this should not discourage you for pursuing this pathway. Next, there is one question from Dr. Afra. She's asking, is a training program necessary for taking paper B, or a psychiatry medical officer's job back in home country of 12 months more also enough for eligibility criteria? Noyon, if you can answer that, please.
Yeah, so I'm going to share again the eligibility criteria for this one. So this is the one you were asking for. So my circumstance was like this, that I'm in an approved training program. So perhaps your one might fit into this. So what I will highly recommend is that you discuss with your consultant, and then that if these things are all covered, if you can see here all this eligibility criteria, that or if you're in a training program, which means it should have all these things anyway. If you are not, then this one is mandatory that your job plan must include dedicated time for academic and educational activities such as attending journal clubs, grand rounds, attending an MSSI course of equivalent, study leave, weekly educational supervision. So all these things are actually part of approved training program. So if you're not in the training program, so you will have to talk with your consultant or the professor you are working under. Then I would highly recommend that once your supervisor or consultant has agreed that yes, these things are all there. If you can have the proof and write to royal examinations at rcpsych.ac.uk. It seems to me that I'm eligible for this because my hospital offers all these things. Can I sit for the exam? So I will highly, highly recommend to always cross-check with this email address, and they will reply to you that yes, you are eligible most of the time.
Thank you, Noel. I think that's the best advice. If you're not sure whether your role fits, email the Royal College of Psychiatrists and ask them directly. They're the best people to clarify that. We have a couple more, and then that's it. So the next one is from Dr. Karatas. So she's asking, do you think sensitive personality or overthinkers are suitable for psych training? And he's also asking, I'm unable to travel due to family. Which areas are most commutable? I think they're asking about location preference for choosing the training. So if you wanna, either of you wanna ask this. I mean, Noyon had been there in 3 years. If you wanna ask the first one.
Yeah, I can talk about the first one. Well, when you in the Oriel, whenever you are trying to fill out any application, there is a question around equality and diversity, where it will always say that in that part, there will be questions like any mental health, physical health, or pregnancy related questions, which means that you should be given the equal opportunities. So what they offer is that in any of the training or any of the job, they would do some reasonable adjustment. For example, if you are an overthinker, that you would really worry during on-calls, for example. On-calls are the one where we worry most. Talking about my personal experience, during on-calls, I have to cover 10 different wards, 4 hospitals to commute whole over Sheffield. So very, very busy compared to other psychiatry places. So that time I can be like really anxious, but it's sort of like I can manage it. But if somebody who doesn't manage it, they can come off the on calls or agree with, no, I'm not. If I can be placed in a different, when there is a different placement, which is a less heavy load one, less busy, maybe he or she can have all their competencies signed off from that placement. So you need to agree with the supervisor that what reasonable adjustment we can do. But to be fair, we all are a bit anxious, isn't it? We all have our anxiety, we all have our some traits of different mental health. If it is impacting your job, I would definitely say that, well, obviously have a discussion, and then in the equality diversity form, if you can see that if anything is fitting with your one and you will need support once you are into the training, then obviously seek help because you don't want yourself to put in danger during on call. So but if you think it's just anxiety, which is other people are having the similar situation, like quite anxious in their first roles, it's fine. It should be okay. You can ask for more shadowing period, that I want to shadow a month of on calls. I want to have like 10 sort of on calls to shadow. So you are not really having the on calls, but you are actually with somebody observing how they are doing the patient admission and so. And then you can decide that whether shall I speak to them that I'm very anxious, probably it's not for me. And they will be able to help you. Okay. So allow yourself some time. You are not straight diving into the on-calls yourself.
Great answer. Thank you. I think there are these sort of safeguards in place for both, more so in training and even in some non-training jobs as well. If you they often don't let you go head on into the like the difficult situation. More trainees in training post, there are these sort of safeguards available in most of the training schemes, so which is a good thing. Um, any anything you guys want to say about training preference in terms of where you don't need to? I mean, I don't know much, but like is less commute or anything. Psychiatry seem to be like a big area you guys need to cover in many places. I think you guys, both of you guys can chip in terms of commutability areas you guys need to cover and all this sort of stuff. Flo, yours, both of you.
Zach, you want to go ahead because you must have done the recent preferencing.
Okay.
Mhm.
So it depends, like where do you want to work? It depends on lots of things. Number one, psychiatry job eligibility. It's
Saki,
not
can I
mandatory.
just interrupt you for a second? Is having a car must for psychiatric training? Can you answer this?
That was I was telling about. It's not
Yes.
must, but they prefer that you should have a driving license. And if you could drive, then it will be easier for you to drive around the different sites. If I say that you don't have any car, it's not a problem. It's not the end of the world. Most of the hospital, most of the trust, they have a car. And also, so, like I say, in my site, I have to cover different side when I'm on call. If I say them, if they bleep me that we need help, you need to see a patient. If I say that I don't drive, I don't have a car, uh, either they will come and pick you up, or you can call a taxi. You can claim this fare from your expenses. And there has been some other cases that if the patient is stable enough to come, they normally come to the main basis, the central basis. Basically, the patient will come to you. You don't have to go. So it depends on the different trust. So when someone is going for the preference, I would say you do a research. Like my North Wales whole sites, I work in Wrexham. It's east side. North Wales have west and central as well. So as far as I'm aware, east has less distant sites. Like I used to work in Bangor, like west. So Bangor used to cover many sites. At least you have to drive at least 20-30 minutes. And also these parts are remote. You'll struggle to get taxi overnight. And also few other sites are forensic unit, which could be intimidating in the initial career. But my side, like my Wrexham, doesn't cover a lot. The longest side I have to cover, it takes only 5 minutes to drive. And if I can walk, I go by walk by in 15 minutes. So it's very easier. So I would say if you want to, like if you are not a driver and if you are worried about traveling to different sites, do a research about your preference. And also preference also depends on lots of things, because I didn't move from North Wales because of my family. I wanted to stay with my family, with my wife. And different people prefer different things. Some people wants to stay in a big city, mega city like London, Manchester, these things. But because I started my career in North Wales, I fell in love with countryside and quiet, calmer area. So I prefer to stay in North Wales. So it depends totally on personal circumstances.
Yeah, I can touch upon that for a little bit as well. Thank you so much, Saki, for the insightful conversation. Well, again, the preferencing is a big task, really. Like after you have been sent out for preferences, you will have to do a really comprehensive dig in. For example, when I was doing the preferences, I was looking for the cost of living. For example, cost of living in London is like pretty much high. So I ranked London places like pretty much down. Whereas um, cost of living in Sheffield is pretty much like bearable, and it has got both the city vibes. It has got the vibe of like if you just drive 20 minutes past or 25 minutes, you will have a lot of countryside experience, and it's so much diverse. There are lots of like Muslim community, Hindu, Christian, so it's a multicultural, very diverse. So I wanted to be in Sheffield itself, that Sheffield and its surrounding place, because of the cost of living, because of the multicultural diversity. And there is something also a site, if you search by, I think it's called the National Training Program, something like that, where Saki, do you have the name for that, where they show like which trust has got the highest like
It's in
satisfaction rate?
GMC website.
Yeah.
So it says GMC trainee surveys.
Yeah.
Every year, GMC takes feedback from the trainees. They usually give feedback from from trainees, like how they're coping with the work, how are their supervisors, how they're having protected time for the study leaves, on these sort of things.
Yeah.
But I would say all over the UK, they actually follow standard guidelines, standard procedure for everything. But anyway, different hospital, different trust varies, like quality wise. It depends.
Yeah, I do agree with that. And then again, part of me was choosing Sheffield or South Yorkshire is because Yorkshire was scoring 90% satisfaction from trainee, which was like pretty much high compared to others. So depending on what you really want, and about the commute, I even take sometimes taxi for the on-calls. If I'm thinking that it's so much busy, we have got a taxi service and we are given the password, the account details. So initially, we could have called the switchboard and they will book the taxi for us. But nowadays, it's so much, everybody is asking for taxi so much because sometimes it can be really overwhelming. So they have actually given us the account. But then again, you will have to use it wisely because they know that who are on calls and who are not. So don't use it for personal use because the account name says on call trainee doctor. And then you will be given the password. So you can ring the taxi service, get yourself taxi booked, and then go and see the patient in the hospital. So nobody expects that definitely you will have to be driving in the first 1 or 2 years. They will always allow you. I'm a CT3. I still sometimes, if I need to use taxi, I will do. I would always tell them that it's very difficult. Sometimes the network is not that good. I have to drive like 45 minutes to go from one place to the other. If two different hospitals are that much far away, so that can take up to 45 minutes in traffic. So, and if I start receiving 4 or 5 calls, I can be like really distracted and patient might have to wait. Whereas in the phone, I can give a lot of information, lot of management. Maybe somebody has fallen ill, I can ask for the physical health observation. So I can sort out a lot of things. So if you can drive and do all your things, that's absolutely fine. But if you think I might be anxious, I might be overwhelmed, you will be always allowed to use taxi. Like most of the time, I haven't seen that they have caused any trouble.
I want to add one more
Fantastic.
thing. Come to Wales because Welsh government uh, funds for MRC psych exam papers for one attempt. So they will pay for you paper A, paper B, and CASC. Come to Wales. It's a very good place. I'm selling my area really. So Welsh people are very nice. They're culturally accepting to the IMGs. So far, I work here 2 years. I didn't face any racism. I didn't face any complaints from the patients. They're really nice. So it could be a good options for you. And also, it's a very nice countryside. You'll enjoy.
I would like to sell Sheffield as well for the similar
Mm.
sort of reason. If you want a reasonable city vibe, if you want to work one of the big cities, but at the same time, if you just Google Peak District, you'd be like, that is the place I would like to really live. It's just like 20, 25 minutes away. And CAS center all over the UK, even all over the world, only the CAS center is literally 10 minutes away from my house. And people are traveling literally to the cask, and I was like, "Ooh, that's just 10 minutes away from my house." Nowadays, yes, there are some other 1 or 2 centers in different parts of the world, but if you live in Sheffield, you're gonna love it.
Right. Right. So yeah, both is great to see happy trainees who are happy in their locational deaneries, which is really great to see. I've just been from North Wales, where I visited Saki. Really nice. You got sea, mountain, everything you need. I've been to Sheffield a few times again. Sheffield is really nice. Peak District is only 20 minutes drive away. So yeah, both of them these are great places. But I mean, obviously, just to sum up, is your training location depends on your preference. What do you want? Do you want to work? Are you happy? Leave it. Consider the finances. You want to leave it a bit of a cheaper place. Anything that London touches becomes gold and unbearable for many people. Yeah, and then you want to live countryside. Are you happy? You want to buy a house maybe down the line. You want to get to a place which is not, you don't need to spend 800,000 for a house. You want to buy a cheaper place, a cheaper house. Yes, a lot of things. UK is not a massive country. It's drivable and commutable. But obviously, the great things I love about training is in UK that the trainees get generous transport budget, study budget, and generous study leaves as well, which is really great. You can claim these things back. So even if you don't have a car, as Noan and Saki said, you can use a taxi and claim that back through the itinerary and everything. So that's the thing that answer your query, I guess. I think our last query is um, Dr. Safina has come back to us and she's from Nigeria and she was asking, is it possible to apply for jobs with just MR Psych paper A and B? I mean, in theory, some college sponsorship, but I'm not sure about the psychiatry specific thing. Noyon, any idea about this?
So, well, I have seen somebody like who got their sponsorship after paper B. So I would highly recommend like once you have started applying for it, or even you can just look out for the jobs that if it's still they are sponsoring like giving the GMC registration, because all you need is a GMC registration to work in UK. So if and most of the people or one or two people I have known that they have completed their paper A and B and then they have applied for their jobs and they have offered registration and giving a sponsorship to them. So if you fit into that criteria, if that job description suggests that what they are going to offer you, then why not? There is no harm applying for it.
Yeah. Yeah. I mean, just to add, like any sort of job, I mean, most people in UK would come either take PLAB or UKMLE or take their Royal College exam and GMC registration. Obviously, many people know, but just to remind, there's two other ways of get GMC registration when you get a job. Number one, you come through a Royal College sponsored program, which is called MTI, Medical Training Initiative. These are run in collaboration with the college and GMC. So they do announce from time to time post availability and in their college website. The other thing is directly hospital sponsored transfer, hospital sponsored GMC, which no one has mentioned. Some of these hospital actually can, if it is in Hartfield area or Hartfield post, they can sponsorship. If you're experienced enough, you do fit the criteria, you are selected for the interview, and they find you are the best candidate, they are able to sponsor you. So you need to find the right people, right hospital, right post for that. Not the most common way of getting GMC, but it is doable if you tick all these boxes, I think. Uh, yeah, I think we had quite a few good questions from all the participants. Thank you very much. Before we go, I mean, it's been a lively session. Saki, Noyon, from both of you, any further tips you want to share for our participant or anything else you'd like to add towards the end of our session? Anything else you'd like to say?
Saki, do you have
I
any?
wanted to share one thing. Oh, Noinapu, you go first.
Oh,
Sorry.
no. I said the Saki, if you want to go ahead first.
Okay. So um, I think the question was like if I can apply for job after doing paper A and B. So I have seen one specialty registrar, Sasket doctor in my trust, um, who had experience in psychiatry. Like they have done MD in India. They had experience of psychiatry in India, and I think they didn't do any part of psychiatry. I think they have done only MRC psych part A. So they had GMC registration sponsored by I think by MTI pathway, and they are doing their job and they are now cracking other parts of MRC Psych and preparing their portfolio for higher specialty training. So the main point would be if you want to come to UK to a non-training job with MRC Psych, I think it's good to have some psychiatry exposure, some psychiatry training, and then it will help you to get a job. But other than that, it's very competitive nowadays. Without any experience, I would say its possibility is nearly zero. But it's not impossible. People are still getting jobs. They didn't close the door forever, but it's difficult nowadays. Thank you.
Yep. Thank you so much, Saki. That was really helpful. Um, and from my end, I will say that some of the question that was not asked here, one of the things is that, Apu, I have myself bipolar disorder. I'm diagnosed with bipolar disorder, some say, or I have got personality disorder, or I have got this and that. So am I suitable for getting training into psychiatry? Like, because I'm having mental health disorder, so am I the right person? But I'm interested in psychiatry. Well, I have seen a lot of colleagues that they have mentioned, I've got ADHD, I have got autism, I have got this and that, I've got bipolar disorder. It shouldn't stop you. When you are starting your job, if you are fit and fine, if you are managed your symptomology by medication or whatever it is, you are good to go. It shouldn't stop you. It shouldn't stop you progressing with your career pathway. Not in psychiatry, not in every other jobs. You should be suitable if it is under control. It's just that some of the jobs might ask you, or just that, do you want to disclose that what you have got so that they can do some sort of reasonable adjustment? For example, if you're an anxious person and then you know your trigger, that if too much pressure on me, I might get like too much triggered and I might collapse. So it's best to disclose sometimes, and then so that you are not put so much into pressure, and then you easily roll with the system. So yes, you can go for it if you have any mental disorder. It shouldn't stop you.
Okay. Fantastic. I think it's just that the way the systems are set up, not just in medical science in UK, you mentioned this word, reasonable adjustment. Very, very important. It's just not for medical science or job. When you book an exam for a driving license exam, they will ask you for, do you need any reasonable adjustment? All the different aspects of life, they have these wonderful things. Yes, they're not ideal all the time. Sometimes it depends on the local arrangements as well, but they have this and they will try when possible to do reasonable adjustment. I think it's Sunday afternoon. I don't want to keep prolonging the session any further. So I want to close this session by thanking our guests and all the lovely participants, and we really appreciate all the questions from you. Uh, I did ask about your email IDs if anybody would be interested about this. A couple of people has replied kindly, so will be sending them later our presentation. Just to remind you, DMC Alumni Association UK, we are one of the oldest medical school in Bangladesh, and we will be arranging more further sessions down the line to carry on with our webinar series, which will be helpful for people of different specialties as well. We have an expertise from all different specialties, and we'll be carrying on that. Now, with that, I'd like